Hey, it is Dr. Kre. I'm sorry I'm late, but I got tied up at the nursing home. So here I am. We're going to do Dr. Kre and me tonight, and we're going to talk about 4 things that you should know about HIV and AIDS. So as you know, or you may not know, December 1st was actually World AIDS Day. And it's a day where they do a lot of HIV and HIV testing on that day, a lot of educating on that day, it's just a day that's there so we can remember, hey, like you get your yearly pap smear every year. You can say on December 1st every year, I'll get my HIV test every year. So, hey y'all, sorry I'm late. I had to work late. So I am here now. So today we're going to talk about 4 things that you need to know. 4 things you need to know about HIV and AIDS. There are a lot of great things coming down the pipeline. And with December 1st being World AIDS Day, I felt like it would be a great time to kind of talk about it and bring it back to our remembrance, some things and some things that you guys may actually not know, but it's actually very important to know. So I'm going to get started since I'm already about 15 minutes late. I had to work late. And on Mondays, I go to the nursing home on Monday afternoons. And it is kind of hectic sometimes trying to get back across town. Usually I don't have any problems, but today was a little bit more hectic. It's all the construction they got going on. So you know who I am. I'm Dr. Kre. I'm your board certified family medicine physician. And I specialize in what's important to you through my weekly videos, my telehealth, my concierge medicine, and my just amazing family medicine practice here in town. I help you guys learn to love yourself even more than you did already, because I know you all love yourself already. I want you to learn to be able to ask the right questions when you go to the doctor. Be mindful of your body, love yourself, and take care of yourself. That's mind, body, and spirit. Okay, so number 1 of 4 things that you need to know about HIV is, number 1, everyone needs to be tested. Can somebody type that in? Number 1, everyone needs to be tested. So you need to be tested once a year. And if you have several different sexual partners, you also need to probably be tested, every 6 months. That's okay as well. So let's talk about being tested. So when you get tested for HIV, I like to tell my patients, we have to do some education for them before we do the testing. And I say, hey, testing is so amazing now, and it's so proficient and sensitive and specific. So they do a lot of testing that if you actually get a positive, if I call you back in and say, hey, come on back in, I need to talk to you, your HIV test was positive, I need you to know that they actually did several confirmatory testing to be sure that you really, really, really do have a true positive. So they'll check you on and on and on and on. Like I've had a patient that had the test results came back, and like the first generation was positive. So if they had been out somewhere, they may have gotten a positive rapid strep. So now AIDS Alabama is who I often partner with, and they go out and do home HIV testing kits. And her home test would have probably been positive, but luckily she was in the office and she had all of the confirmatory testing done. So we were able to, with confidence, say, ma'am, no, you do not have HIV. So just know that if you're being called with a positive, there's been a lot of more testing done to that blood and you have a true positive. So number 1, everyone needs to be tested. Cannot stress the importance of getting tested. Ladies, what you can do is you can decide to say, hey, it's my pap smear time. Once a year, I'm going to be tested. There was an old adage that you could only be tested if you were, in the healthcare industry, men who have sex with men, IV drug users, whatever. But now I just advocate that everyone needs to know their status. If you get a life insurance test, they're going to test it. But testing for HIV isn't just something that when you go to the doctor and have your general physical, it's something that's going to be checked because you have to ask for the test. We have to get consent for the test. We don't just go around and blatantly start checking HIV on everybody in the whole wide world. So, HIV is very, 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 very prevalent here in Birmingham. With UAB being here, there's a lot of cutting edge research that's going on. We do have what's called the 1917 clinic in the area, and they offer some free resources, free medications. They are amazing. So, it's not like it was, 20 years ago, maybe even 10 years ago. There is actually a lot of knowledge and research out there that's been conducted. So if you have a positive diagnosis, this isn't anything that you need to be ashamed of. You actually need to be very proactive, get on the right drugs, and, get on to living a healthy life. Which leads me into number 2. Hey, y'all, I don't know who's come in because y'all haven't said hey. So number 2 is life expectancy can be close to normal. Pretty much normal. I take care of several people with HIV. We treat them no different than we do you or anybody else. We know that I always joke and say when I'm going through my list of what's going on, oh, how's your heart doing? How's your cholesterol doing? How's your this doing? And the very last thing on my list is how's your HIV doing? Because I know, hey, Sean, because I know that his HIV is actually undetected. He's on great enough medications. Hey, Dr. Ijama. He's on great enough medications that the virus is really not detected in his blood. So that's so exciting and that's so reassuring. And so I train my staff to know that, yes, we do universal precautions, but we do the universal precautions that we would do for you or anyone else. We're going to love on them and treat them just like we would the rest of our brownstone family. There's no difference. If you want to keep your job with me, you better treat them like they're all the same. We're not going to stigmatize people. We're not going to isolate people. We're there to love on them. So usually, like I said, number 1, everyone needs to be tested once a year. Number 2, life expectancy is close to normal for people with HIV or even AIDS. So you have to realize that it's something else that's going to kill them more than likely, as long as they're taking the medicines like they're prescribed. It's usually things like heart disease is really prevalent. High cholesterol is prevalent. Cancer is prevalent. Those are all things that could actually usually would kill them instead of the AIDS virus. So let's talk about it. HIV is usually diagnosed early in the disease. And once you have what's called an AIDS defining disease, then you actually end up getting AIDS. So what's an AIDS defining disease? That would be PCP pneumonia. It's when they have this. I've taken care of 2 people, I think, in my career with it. The first one, he didn't know he was HIV positive. I didn't know he was HIV positive. He was young and healthy and had a lot of breathing issues. We could not get his oxygen to stay up. He was not asthmatic. None of this. Nothing. He didn't fit any bill. So you start checking things like, oh my gosh, let's check everything. So we checked it. HIV came back positive. We sent the testing off for the PCP pneumonia, and it took a very, very, very long time for it to come back. When it came back, we were able to treat him with Bactrim, with antibiotic, and with steroids, and he actually did fine. Walked out of the hospital and was doing pretty good. So that's the difference between HIVs. You got the diagnosis, thrush in the mouth. That's a AIDS defining illness. Something called Kaposi's, which is a lot of these really dark lesions, a rash, dark lesions on the skin. It's what I imagine leprosy would look like, but I'm sure that I've never treated anybody with leprosy, but for the lack of a better way to describe it. So those are some diseases that you can actually get that tips them over. And also when their T cells and B cells and all of that get to a certain level, CD4 cells. Hey, Auntie Deborah, when they get to a certain level, you can be defined in that way as well. So, number 1, everyone needs to be tested. Number two, you can live a near normal or practically normal lifelong expectancy as long as you're on medications. You're getting medicated, and the drugs are out there are amazing. You know, years before, there was like this stigma that you had to take 25 different medications if you had HIV, and that's not the case anymore. Like one medicine could probably have 2-3 combination medicines in there. So they're combination drugs. They may be on one drug. They may be on another drug. Hey, Cherie. So just know that they're not on bukus of medicines for the HIV. Now, some of the medication side effects could be high cholesterol or that, worsening of your blood sugar, leading you to think that they're becoming diabetic. So those are some of the things that the drugs itself can do. So now you see why I'm like, okay, HIV is fine, but a lot of the drug side effects can precipitate other illnesses. Ijama said that's the way you describe Kaposi's is how my dad describes it too. Right. So that makes me feel a lot better because your dad has been a doctor much longer than I have. So number 3, there is a medication that can actually prevent the transmission of HIV. And to your surprise, a lot of doctors do not write it. Here in Birmingham, I'm one of the few family medicine physicians that actually writes it, and it is called PrEP. PrEP. Can somebody type that? Let's see. So how important is it for your partner to be tested and you're set before you guys decide to come sexual action? Yes. It's very, 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 very important for everyone to know their status. Earlier in the video, I said that I think once a year, everybody needs to be tested, whether you feel like you're monogamous or not. Get tested. It will not hurt anything to be tested. So, yes, thank you. Somebody typed that in. PrEP. Yes. So there is a drug. Yes, PrEP is an amazing drug. So PrEP is recommended. I need you to type this list out for men who have sex with men, for obvious reasons, for domestic violence victims. So when I was talking to my friend about that, I was like, I don't really get that. So women that are in domestic people, women and men these days, because I learned this weekend that 23% of men are actually in 20% of men are actually in domestic violence relationships, as to 30% of women have admitted to being in not sexually, but domestic violence relationships. So it's a real thing out there. So men who have sex with men, domestic violence victims, because they are probably being forced to do things out of their ordinary that they may not necessarily would do on a regular basis. So men who have sex with men, domestic violence victims, prostitutes, sex workers, and I leave something. IV drug abusers, and of course, if you are in a relationship or sleeping with or married to someone that has HIV. I have several married people in my practice, and that one partner has HIV and the other partner does not, because the partner is on PrEP. So that is my really, 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 that's a joy of mine, a passion of mine, because I'm able to help them. So let's talk about PrEP. PrEP is amazing. PrEP is, you can take PrEP, the drugs that are in PrEP actually can be used for treating HIV. And it also can be used for prevention of HIV. PrEP is kind of tricky, because if someone got the virus and had been on it before, like later, you have to trick your body, because HIV is so stinking smart. Such a very, very smart virus. It tries to out trick those drugs. So you have to be mindful of, once I add someone on PrEP, or if they got the disease from someone that had been on PrEP previously and stopped and got HIV after coming off the drug, then that affects what this person and this medication that this person can be on for their HIV treatment. So your primary care doctor or an GYN an internal medicine doctor. They actually should be checking you for HIV. They may feel very, very confident in the treatment of the HIV once the diagnosis is there. I'm still in the iffy, washy phase on being able to start the medicine. So a lot of times I partner up with an infectious disease doctor and say, hey, I have someone HIV positive. This is a very new diagnosis to them. This is as much information as I know. I get the correct get the correct lab results, and I send them on to the infectious disease. If they do not have insurance, or if they the infectious disease doctor doesn't take their particular kind of insurance and they're in Birmingham, I refer them to the 1917 clinic, which is amazing, which is a great clinic, a great resource. So, like I said about PrEP, one, everyone needs to be tested. Pick a day, get tested once a year. Number 2, lifelong expectancy is close to normal, if not normal. Number 3, there's a medication for prevention called PrEP. And it's expensive, but insurance does help pay for it, and you can get a coupon. And I think you can get it for about $50 or even less. So we work with the patients and put them in touch with all the right people, the people at AIDS Alabama. And my good friend, Tony Christian Walker, has been amazing at helping me to plug in patients in the right way, get them tested if they need to be tested more than one time in a year, because insurance really only wants to pay for once a year testing. And you have to have the code exactly right, or they decide not to pay for it. But we won't know that they're not going to pay for it until you already got your negative. Okay. So 4 reasons. Number 1, everyone needs to be tested. 2, lifelong expectancy is close to normal. 3, yes, there is a medication that can help to prevent the spread of HIV. And people are like, I don't want to deal with that. But it's no different than in the 70s when people didn't want to write birth control. They thought it was given permission. Let's see. Please touch on, do not feel it as if a negative is to ask to be. I'm sorry, I can't understand it. It's being responsible in doing so. It's protecting both of us as a couple who's just beginning. Okay, I see what you're saying. So you're saying that even if you've had a negative before, don't be offended if your partner asks you to get tested again, because you just want to be able to show that proof. And a lot of times, I know when I got my test, I got tested for hepatitis C and for HIV earlier this year. And they give you a little card. They give you a card that you should not be going anywhere. They're like, yeah, I'm negative, but they don't want to show you any proof. Everybody, every doctor, every office will be able to give you proof that, yes, you have a negative test. They're going to give you that lab result. They give you a little card that says, yes, it's actually negative. However. And number 4, not knowing your status is not an excuse. So it's not an excuse. It's not an excuse to go out there and to sleep with whoever you want to without knowing if you are endangering yourself or if or someone else is endangering you. So it is not an excuse. So you must know your status. If you're out somewhere and they're offering free testing, which I know they do all around Birmingham all of the time. So go get it tested. A lot of people are like, oh, I don't want to know about that. You cannot get it from sitting on the toilet stool. You cannot get it from drinking behind people. It's like on and on. You're probably working with people on a daily basis that have HIV that you have no clue. They look healthy. They look just like you and me. You would never know. They not spunking in and shrivel up, especially if they have been treated like they supposed to be treated. They're on medications. They live healthier lives. Something, my really good friend, he always says, my acid reflux gives me more issue than his HIV. So it's manageable. Treat it just like you treat any other common disease, be it diabetes or high blood pressure or heart failure, high cholesterol, heart disease. It's just that one and the same. You use your normal universal precautions as if you would with any and everybody else. And you go from there. So number 1, everyone needs to be tested. Know your status. Know your status. I can't say that enough. Know your status. Number 2, lifelong expectancy is close to normal. Number 3, there is medication out there to prevent the transmission called PrEP, which I absolutely love. I do write it here in Birmingham. It's common for men who have sex with men, domestic violence victims, IV drug abusers, HIV, and people whose partners already have a known status of HIV and AIDS. And it's not a gimmick. I mean, I'm telling you, I have people that are in loving relationships that their partner has HIV. And they do not, because of the wonderful drug of PrEP. And number 4, not knowing your status is not an excuse. Just because you're 60 years old and you've been with that person a long time, you should know as well. So everyone's entitled to one once a year. So things that you need to know. How can you prevent it? Prevention is either abstinence, which you have to say because you're in that form, or condoms. Condoms. Protect yourself. Protect yourself. And if you're a woman, don't leave it up to him. You be the shero that you are. You be the heroine, and you have your own condoms. You protect yourself. You hold your own. You hold your own fate in that regard. Either don't do it, or if you're gonna do it, have your own protection. What kind of questions do you guys have? Do you have any questions? In a new relationship, feel free to ask your new partner to go and be tested, and other partners do the same. Yes, this helps to start your relationship off and on a clean slate, so you know that everyone is safe. I think that's great. That's a great way of putting it. I think that, just making sure that you get that all out there in the open before you even thinking about each other naked. Let's just know our status. Hey, let's just go to the doctor together. You'd be surprised at very few couples that come together that I see. Now, they may go to the health department. They may go to AIDS, Alabama. I don't know. But I don't see a lot of them coming in together and say, hey, I want to know my status. I want to know his status. Because remember, it's a slow growing virus. It's a virus, just like a cold. It can be normal for years and years, and all of a sudden it pops up. Just because you don't get the virus from this partner doesn't mean you didn't get it from someone else. So be mindful that it is out there. There is such a thing to be concerned about. And but they're also making some amazing strides in it. The research is amazing. The research is amazing to have a prevention drug, in the 25, 30 years that it's been out. So it's like, oh my goodness. It's great. Sean said, I have a friend whose skin was breaking out bad. He went to the doctor and found out he was positive. Well, that's good. He went and they checked. Yes, Truvada is the brand name for PrEP. Thank you. Is the medication expensive? Yes, it is expensive. However, but if the person has commercial insurance, you can get a coupon card. And we work with a company here in Birmingham that we set up that I say, hey, call them. They'll help you figure out how to get it covered. Usually it's about $50 or so with the coupon. They take the medicine daily. And help you ask that because you have to get blood work done if you're on PrEP or Truvada. If you're on Truvada, you have to get your kidneys checked at baseline. You get your iron checked at baseline. You get an HIV test then. You get your liver tested then. You get a hepatitis B tested. So you get all these things tested because it's going to keep your immune system low. It's going to keep everything at bay. So then in 3 months, I have them come back. We do all these testing. So even though they're on the right medicine, I have run into the fact where insurance is like, we don't want to pay for that anymore because this is a young, healthy 22-year-old man. Where in Alabama, that's when you pick up the phone and call my friends at AIDS Alabama and say, hey, Tony, I need some help. Can you, make sure these people get tested? Let's see. Can patients get this medication for? Yes, I think I answered that question. Yes, they can get it for a reduced price. $50 is about as cheap as you can get it. And I think if we talk to Gilead, I think they may be able to find it for free, but I usually just tell them about $50 with the coupon. How often do you follow up appointments with your HIV/AIDS patients? So I don't have any that I actively manage the HIV. They see the infectious disease doctor or they go to the 1917 and I see them just like I would anybody else. So that's every 3 months. If they got other comorbidities, every 6 months. Hey, Aaron, let's see what you say. So you can have it, but if you get with a certain person, it can start up. No. That's not what I meant. It can be in your system just living dormant. So say for instance, your immune system gets weak. And then just like a cold. So how a virus works, the cold virus is in your body all the time. So it's there. And if your immune system gets weakened, say for instance, you're on steroids for something, then the virus can stir up, or however your immune system can get weakened on several different ways. The virus can show its head. And then you're like, oh my gosh, I got a cold. I feel so bad. So just treat HIV. Think of HIV in the same way. So it's not that you got with a certain person and you end up, it showed up. It's a means of that it was already there. And you didn't necessarily get it from this person. You could have gotten it from somebody before. It can start up, and how fast can you know, like same day? How fast can you know, like the same day you and your partner are together? No. It's a slow growing virus. This is nothing that's going to pop up like you had sex today and you're going to be HIV positive tonight. So that's why we encourage getting a yearly testing. So you go get tested because it's a quiet thing. It's quiet. Some people don't have symptoms. Some people lose a lot of weight. They are coughing all the time. They get thrush in their mouth. Weight loss is a very, very, very big one. Diarrhea. They can have a lot of symptoms, but some people don't have any symptoms at all. So just be mindful that if you've been with more than just one person, and if you've been with one person, then you're at risk. And if they've been with more than one person, so you just have to be mindful of those things. Get tested once a year. Thanks so much for answering that question. Okay, I answered it. So if there are not any other questions, thanks for answering about asking your partner to be tested, because that can be a very yes, and do it in a playful way. Do it before things get to be so touchy-feely and that kind of thing. Have that a part of your conversation, that you're just like, hey, just FYI, before we get to that point, we're going to have to go get tested. Oh, I don't have no insurance, so I got this excuse, I got that excuse. There's always a health department wherever you live. You can get tested for free at the health department. Also know that if you have had other sexually transmitted diseases, that being chlamydia, gonorrhea, trichomonas, herpes, you're at risk also of getting HIV. So if you get one STD, you're at risk of getting others. Hey, Keisha, yes, girl, I'm finishing up. The 4 points were: everyone needs to be tested. 2, lifelong expectancy is close to normal these days because the medicines are amazing. No one's taking 25 different medicines just for their HIV. They're taking, medicines that have combination drugs in them that work awesome. And that number 3, there is a medication to help with prevention, to prevent transmission, and that is PrEP or Truvada, which is the brand name of it. It is expensive, so insurance can cover it. If you're commercial, but you also need a coupon. It'll be about $50. Men who have sex with men, people that are in domestic violence relationships, IV drug abusers, and if you're in a relationship or married to or having sex with someone that already has HIV or AIDS, and you yourself are negative, then you need to be on Truvada. I'm in Birmingham, and I do write PrEP. One of the few primary care doctors that write it around here, because I believe that we need it. We need to treat it just like we did birth control years and years ago. So I'm sure in the next 10 years, everybody be on PrEP and writing PrEP, and they'll be paying for it just like with birth control years ago. And number 4, not knowing your status is not nowhere near being an excuse. Okay, cool. Thank you, Ijama, for that, Dr. Ijama. She put the CDC link in. Knowing your risk of PrEP, and if you are here, we do have several resources. AIDS Alabama, the 1917 clinic. Just know, December 1st was at World AIDS Day, and I wanted to go live then, but I got busy or something, so I was like, today we're gonna talk about it. And I was hoping that my friend Tony was able to come on. He works for AIDS Alabama, and he's a very big resource to me. I love him a lot, because when I'm like, oh, is this a good candidate, or what should I do? I usually just pick up the phone and call him. He's been an awesome resource for me and also an awesome resource for my patients. So just remember that we are not an island. As your doctor, I have to have good resources, good connections that I can just pick up the phone and say, hey, you see my little microphone? Yes, ma'am. So I can use my hands because I like to use my hands when I talk. Anyway, if you guys tried to go to the link last week, make sure to check your spam box, because I heard that some of the link for the 4 reasons why you should have more sex. Perfect segue with this story. You probably don't want to have any more sex after talking about HIV. Make sure to check your spam box. But the link for that is coaching.workingwivesclub.com/Dr. Kre, DRKRE, another backslash. You put your email in there, it'll send it, and it's me and my voice. So you know it's going to be hilarious. I'll write the link in there. And put your email in, it'll come to you, and then a couple of days later, you get a good juicy bonus as well. So I have to run. My husband is home. I have to go see how his day was. So anyway, guys, you know who I am. I'm Dr. Kre. I'm a board certified family medicine physician. Thanks for waiting up a little late for me. I got stuck in traffic. I am a board certified / not backslash. I'm a board certified family medicine physician, and I specialize in what's important to you. And today, I wanted you to know what it means to know what's going on in the world today, in the world of HIV and AIDS. That it's so much more broader than it was 15 years ago. So the more you know, I think the better you'll do, the further you'll go, the more love that you can show other people that have HIV and AIDS. Don't be that person. Don't be that person. Be like, yeah, don't be that person. So anyway, I want you to live healthier, happier lives and be full spiritually, mentally, and emotionally. All right. Anyway, I'll write the link in there, the link to get the 4 reasons on why having more sex is good for your health. I'll add that in there because I got to have 4 slashes and not backslashes. And also, thanks, Ijoma, for taking notes. I will see you guys next Monday. She is adding my notes in there. Thank you. Thank you so much. All right. Have a good night.